Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honorable John Hagee, Minister of Health and Community Services, joining us via Skype from Gander. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone. And we've all come to know that this pandemic has been challenging. And it has posed some unique challenges on communities, which includes the Indigenous communities throughout Newfoundland and Labrador. And since the beginning of this public health crisis, we have been working very closely with those communities, with the Indigenous groups and organizations, to ensure that the safety and well-being of their communities. The collaborative engagement continues to strengthen the working relationships as we look forward, and we will look forward to continuing to work. Matter of fact, later this week I will be speaking to many of those leaders again. As Premier of the province and as Minister for Labrador Affairs, it would be remiss for me today if I did not take this moment to recognize the first anniversary of the release and the final report of the National Inquiry into Missing and Murdered Indigenous Women and Girls. It took a lot of courage for the families and the survivors to relive what was tragic losses during the inquiry. This can never be understated. Violence in any form will not be tolerated. And I want to thank particularly the elders, the knowledge keepers, and experts who shared their insights of their lived experiences, and they informed us then, and they will continue to guide us now. We all know that it is by working together with the wisdom and the traditional knowledge of our Indigenous peoples that we will be able to advance reconciliation and the National Inquiry's call for justice. I will now turn it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have no new positive cases, and the total number of cases in our province remains at 261. One person is in hospital due to the virus, and 256 people have now recovered. In total, we have tested 12,619 people. For weeks now, we have done exceptionally well in keeping the number of new COVID cases in our province to a minimum, and I'm grateful for the dedication, bravery, and single-minded determination you have each shown to help keep your loved ones, yourselves, and the most vulnerable members of our society safe during this pandemic. I truly hope you realize the significance of your actions, as they have undoubtedly gotten us to where we are today. If all goes well for the next few days and the number of new cases remains low, on Monday we will be moving to Alert Level 3. This is another significant landmark in our plan for living with COVID-19, and it is thanks to your every effort that we are ready to enter this next level. As we transition into this new phase, adhering to our public health orders in place and practicing our own personal preventative measures will be more important than ever, because as things reopen and more people begin moving about, there is more potential for contact with others. We must continue to stay at home unless it is necessary to go out, especially if you're unwell. Keep a safe physical distance from others in the workplaces and public spaces. Practice proper cough and sneeze etiquette and good hand hygiene. I cannot overemphasize enough the power of these simple actions have against COVID-19. However, when in public and physical distancing cannot be maintained, it is recommended that you wear a non-medical or cloth mask. This additional protective measure will help to further ensure our success in living with COVID-19. Just as we moved carefully and with caution through Alert Level 4, the same will be required for Alert Level 3. We know this virus will be with us for a while, so we must remain vigilant as we gradually resume additional activities and business operations in this next phase of our COVID-19 plan. So beginning on Monday, Alert Level 3 will allow the resumption of the following activities while maintaining certain public health orders to help mitigate risk. Gatherings at funerals, burials, and weddings can be expanded to 20 people as long as physical distancing can be maintained. Campsites are permitted to open for limited overnight camping with restrictions. Summer day camps can operate with restrictions. Medium-risk outdoor recreational activities can resume, but spectators must maintain physical distancing. Outdoor pools can operate with a limited number of people. Outdoor activities, including walking, hiking, or bike riding, are encouraged as long as physical distancing can be maintained and you're not required to self-isolate for any reason. Playground equipment in municipal parks is not to be used, and gym and fitness facilities, yoga studios, tennis and squash facilities, arenas, dance studios, and performance spaces will remain closed. Private healthcare clinics can reopen in accordance with guidelines. Orders related to long-term care, personal care homes, and assisted living facilities will remain in place. Retail stores, including those in shopping malls, will be able to reopen with restrictions. And retail stores are permitted to resume selling scratch and break open lotto tickets in store. Personal service establishments, including spas, aesthetic services, hair salons, body piercing, and tattooing and tanning salons, can reopen in accordance with guidelines, and daycare operations will be further expanded. Restaurants will be able to reopen at reduced occupancy, and buffets remain prohibited. Bars, lounges, and cinemas will remain closed. For more information related to our provincial COVID-19 alert system, including a detailed summary of public health guidance for all alert levels, please visit gov.nl.ca/COVID-19. Every decision made by public health is weighed carefully and thoughtfully, and ensuring your protection and that of your loved ones remains our top priority. We will continue to provide you with the guidance based on the best available evidence. While COVID-19 will be with us for the foreseeable future, this does not mean our lives should remain on hold or that we can't participate in daily activities and social connection with those we hold dear. In fact, as we move forward, I encourage you to find happiness and contentment in doing the things you enjoy, but just please do it safely. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in our province remains at 261. This pandemic has, without a doubt, challenged us and tested our resolve, but it has also provided valuable learnings about ourselves and about each other. It has shown us that progress often comes through in small steps, that individually we are capable of great things, and collectively we have boundless potential. Let us continue to build on this and move forward with optimism and action. We will get through it. We have already come so far. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. And we see another day, as she's mentioned, no new cases in Newfoundland and Labrador. And as Minister Heggie always says, zeros are good in this particular case. And last week, just a reminder that Dr. Fitzgerald allowed and suggested that we can actually expand our bubbles to an extra 6 people. And just a reminder, this is about 6 people that you consider close to you, and in some cases, these are the people that support and comfort you. So as you do this, continue to make sure that you're responsible and within your efforts, and you do it with caution. It's important now that we keep the momentum and the good work going so we can comfortably move to alert level 3 next week. We are close also to hitting the 3-month mark since the pandemic started, and we know the havoc that this has created on our country, our province, and indeed all around the world. It's been challenging. It's been challenging for many families. And I said before in those briefings that change is the only constant that we have in life. There's a lot of truth in that statement. Change can be good in many ways, but we also know that it's not always easy to adapt to change. It can be stressful, and it can be difficult to figure things out. Sometimes it takes time, but we all know that it takes patience. Change means that we can't go back to the way things were. We must continue to move forward, to learn and adjust in what is the new normal. We must continue moving forward in our plan, Life with COVID. During this pandemic, we have been putting some social and economic supports in place for you and your families. But we have to remember that these decisions that we make must be balanced. We understand that additional demands and pressures on individuals, on businesses, the industries, our parents and guardians during the pandemic. It hasn't been easy, and we commend you for your efforts, your strength, your patience as we work through this together. We also commend employers who have been accommodating their staff with work-from-home arrangements. The thing is, it's not always easy to balance the increased pressures of working in those unfamiliar circumstances. Often with added demands on your time, productivity, coupled with trying to care and teach and entertain your children. And in some cases, there are 2 parents or guardians trying to balance this, and in many, many cases, there's just one. So I recognize the stress that many people in this situation are feeling. I also recognize and respect the adaptability and the efforts that you are making to accommodate the needs and the pressures that you're facing during this period. When we entered into level 4 3 weeks ago, it eased some restrictions in areas like child care services. It went from only allowing children of essential workers to a capacity of 50%. And as Dr. Fitzgerald just said, some of the changes that will be coming next week under Alert Level 3 we'll see moving, and we'll see this moving there on Monday. You will then see further easing of restrictions where childcare capacity will increase from the 50% currently to 70%. This means that gradually families will be able to avail of childcare services again. And we're working day in and day out to guide you through this pandemic. We've made decisions, and they weren't always easy, they weren't always perfect, but decisions that were made for the protection of you and your loved ones. We took a balanced approach. As we have worked together through the past 11 weeks, let's continue to work together as we move towards our plan implementing life with COVID. This plan will introduce us, and we will work together in the new normal. We have had an amazing public health team and public service who have been working extremely hard to support you in every way we can. And once again, I want to remind everyone about the great work that the All-Party Committee is doing and continue to do every morning. We meet to discuss the issues and things that matter to you. Next week, we will be back in the House of Assembly to move to more important legislation to even further support you during this time and into the future. Legislation that will complement the many supports that we've already put in place. Today, supports like the $30 million residential construction rebate that was announced this morning by Minister Osborne. Minister Osborne was joined by Curtis Mercer of the Canadian Home Builders Association. Today, they announced a rebate that will be available for home renovations and for new home construction. It's going to provide rebates up to a maximum of $10,000 for work completed by a registered contractor. So whether it's families planning to build a new home or a retiree looking to renovate, this program will help Newfoundlanders and Labradorians build for the future. So it's if you spend $40,000, you'll get $10,000 back into a rebate. We know that the construction industry in our province is one that has been affected by COVID-19, and it has a significant impact on our economy. The rebate is intended, that I've just mentioned, to stimulate the economy and help create employment through new home construction and renovations. So all the work that we're doing with our all-party joint committee, our MHAs, our ministers, and our departments is to help you and your families. And that is how these programs, like the renovation rebate that I've just mentioned, this is how they get created. So we are introducing new supports on top of enhancing what we already have in place. There's been some great programs that have been consistently around for many years, and we're looking for ways that we continue to support those, and in some cases even enhance those. So really what it comes down to is what the work we're doing is for you, supporting you through this pandemic and towards that new normal. That is where we will see positive change. It doesn't work unless we're all in. So I thank you for listening again today, and I will now pass it over to the Minister for today's comments.
Thank you very much, Premier. And again, zero is, as we've just said, a great number, and it's a straight line for 5 or 6 days now, which is a testament to the diligence of Newfoundlanders and Labradorians. Over the course of the last couple of weeks, the regional health authorities have been slowly increasing the level of planned procedures, scheduled procedures that they can undertake. And this work will continue until we get to a stage where it will be business as the new normal permits. Our current challenge is still around the availability of PPE and making sure that we have sufficient to safely run the service that we run. So it's important to protect our staff and visitors who are availing of services. As part of this, all the regional health authorities will now expand their COVID testing for individuals who are not only being admitted, but also for those who would be undergoing outpatient, what are called aerosol-generating procedures. So that would be things like stomach and upper GI endoscopy and bronchoscopy. Don't feel that when you get your appointment, you need to ring 811 to organize this. This will be organized for you through the Regional Health Authority. They will organize both the test prior to your attendance as well as the appointment for whatever the procedure is. So that will all be taken care of. These plans have been made pretty carefully. They're consistent across the regional health authorities, bearing in mind the slightly different level of service each would provide. We're already halfway back to the levels that we saw this time last year, and certainly we'll get to that landmark without any difficulty, I think, across the system if PPE supplies hold out, and so far they have. Dr. Fitzgerald has mentioned masks, and I think it's useful just to repeat that for the general public, social connectivity we've stressed, but physical distancing is the key here. If you can't, however, because of where you may be going next week as level 3 comes around, all being well, then cloth masks are a protection. They're a protection for everybody else. It's something you can do as a responsible Newfoundlander and Labradorian to help protect somebody else. Dr. Fitzgerald has alluded to a wide range of things that will likely, all being well, open up on Monday. What this means now is Newfoundlanders and Labradorians have reason to exercise discretion in travel. It's not just essential travel anymore. So there will be campgrounds available, outdoor pools, restaurants at limited capacity, and of course the hospitality for which Newfoundland and Labrador is rightly famous, and an opportunity for families to get a bit of me time, as it were, and recreation out around Bonavista or Bay Verte or on the south coast or wherever you choose to go. But that is discretion, and I think people need to be aware that whatever you do in that way, you need to be conscious of physical distancing and masks as a backup. We're nowhere near ready for large gatherings, even though Dr. Fitzgerald's proposal and plan would allow for larger groups over the coming week. We won't see, I think, in short order, any possibility of a return to much larger gatherings than double digits. So Newfoundland and Labrador, keep your distance. That's the key. If you can't, a cloth mask, well made and fitted, ideally with a little nose piece. If you're like me and wear glasses, it will help you not fogging up and walking into things. So the other key message which is out there, which Dr. Fitzgerald made, was stay at home if you're not well. This is still a time where colds and sniffles should not be dismissed. And if you do have any of the symptoms listed, you should call 811. Our isolation from each other physically has worked well for us as a province, and we need to bear that in mind. That is now going to have to be part and parcel of how we operate as Newfoundlanders and Labradorians to do it safely. So, well done. As Dr. Fitzgerald says, hold fast. And with that, I'll turn it back to you, Premier. Thank you.
Thank you, Minister Heggie. And I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press *1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Peter Jackson of the Telegram. Please go ahead.
Hi. As everyone knows, there's a new possible class action suit being launched on the travel ban. I'm wondering if the province is not considering backing down on it, or if it is in the plan at some point to reverse that travel ban anyway.
Well, we're under a public health state of emergency, Peter, right now, and this is one of the reasons why this travel ban was put in place was, the exposure to a traveler bringing a case of COVID, a positive case of COVID into our province. So this was one of the measures that was put in place on the recommendation of public health. So right now, as far as I know, that the province has not been served. the papers about this particular lawsuit. But, I also know that, from a public health and justice and public safety perspective, they're prepared to enter a response to this. But really, this was put in place to protect Newfoundlanders and Labradorians, not about just shutting people out, but this was a public health measure, understanding the impact of bringing positive cases to Newfoundland and Labrador. It's been very difficult as a province, as the minister just said. Newfoundland and Labrador is known for its hospitality, known for its friendliness, and difficult decisions to be made. But it was made from a public health and safety measure to protect Newfoundlanders and Labradorians from traveler-induced positive cases of COVID.
Okay. I'm wondering last night or last week, there's some suggestion that restrictions might be relaxed to some extent with long-term and personal care homes. Is that still under consideration?
Yes. So
yeah. Sorry, Janice, go ahead.
Got to stop doing
that. We have had some discussions with regard to visitation in long-term care and personal care homes. We know that this is something that is of great concern to a lot of people, including residents of these homes and their families. And we realize the importance of visits to the mental health of all people involved. So this is something that we are looking into. We recognize the importance of it. We're trying to do it as safely as we can and to strike a balance, and we will have more information about that in the coming days.
Okay. And my last question, sort of related to the first, we're talking about people coming in the airport, and we've heard many times before that testing everyone at the airport, even though it's only about 200 people a day, would prove ineffective. So why is testing everyone like entering a hospital considered an effective tool?
So the testing for pre-procedures, that some of these procedures can cause aerosol generation, and so that puts people at higher risk. And certainly, unless it was absolutely essential, we would not want to proceed with one of those procedures if somebody was positive. So there's that. And there is, a level, knowing if somebody going into hospital would need to be isolated is important as well. So we are always looking, when we've talked about testing previously, we talk about looking at vulnerable populations with regard to testing, and certainly people in hospital, people in long-term care are vulnerable populations. So we want to do what we can to help protect those environments and those people.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm also wondering about the class action lawsuit. Now that there are 2 legal actions on your hands, are you concerned?
There will be, arguments that will be made. Of course, people, have the right, and so they should, to be able to actually, file those claims. So these claims are there, but, from a public health safety, from a public health measures that have been put in place, we recognize they've been put in place for a reason. As difficult as those decisions would be, what we've seen is similar in provinces have taken similar measures, and this was put in place, to make sure that travelers entering to our province, that is traveling being, in all likelihood being the most likely cause of bringing COVID into our province. These are decisions that was been made with the evidence and advice from public health and safety. So this was really about protecting Newfoundlanders and Labradorians and preventing, cases coming in to our province of COVID. If you look at some of the other extreme measures and put all this in context, we still have people that live within a kilometer away, not being able to visit their parents that are in a long-term care center. So when you put it all in context of the measures that have been taken to protect the population as a whole, and this one put in place asking just for people just for this brief period of time while we're going through this state of emergency to consider that. I've had messages of people that have lost loved ones and that they could not visit their family member during this period of time. So it's difficult. It's a balance that we must put in place, but it's put in place to protect Newfoundlanders and Labradorians.
Thank you. Dr. Fitzgerald, I'm looking for your opinion on, now that the Liberal leadership is to begin, that could mean a snap election within the 12 months is needed, which could mean 200,000 plus people heading to the polls. We know the Federal Election Authority says they need a year planning to conduct a safe election. Saskatchewan's Election Authority recommends a committee of House leaders. Wanting your opinion on this.
Well, I mean, if 200,000 people vote in this province, that would be wonderful. You know, I think there's ways that we can run elections safely within the context of COVID, and we have to look at that. Obviously, it's not a question that we've looked at this moment. We're very concerned at the moment with moving through our alert levels, so that's what we're focusing on. But should the time come and should we have to consider that eventuality, then we'll look at it with the same public health lens that we've looked at everything else, and we will give guidance for how to do that safely. And I'm sure in this day and age we can find a way to do that.
Thank you. And this is another question for you. Monday I'd asked about the timeline for alert level 3, and you had mentioned that it would depend on the results of our surveillance strategy. I'm just wondering if we have a bit more information about what that surveillance strategy looks like.
So our surveillance strategy is based on all of those things that we talked about in the beginning, you know, when we talked about moving from level to level and what we would have to look at, making sure that there was control of the epidemic, that we had healthcare capacity both in public health and in acute care, that we had ways to control importation, that we had ways to make sure that outbreaks could be maintained, and that the public was aware and engaged. So those are all of the things that we need to look at. So our surveillance strategy is going to be looking at all of those things. So we have numerous measures that help us to determine the control of the outbreak and what that looks like. And we also have things that we look at with regard to how quickly contact tracing can get done, what's our bed capacity, what's our ICU capacity, those sorts of things. So all of those things go into making up our surveillance strategy, and no one thing will determine how we move or if we have to revert through any of our levels. It will be looking at that strategy as a whole.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. We spoke to a local child care operator who has been in the business for 40 years, and she says child care centers are preparing to close permanently on June 26th. She says the current situation is unsustainable because many parents are choosing not to come back at this time, it being impossible to exercise social distancing among children, and she expects there will be outbreaks which have been seen in other areas if the virus does resurge in the community. The government subsidy provided to parents ends on the 26th, and she says while that kept child care centers going, she expects things will change drastically when it comes to an end. What's your response to that, and will the subsidy be extended?
So right now the plan is to end the subsidy at June the 26th. So if we think about what we've done over the last 3 months, we put in one of the what has been a great program, and has been recognized by groups right across the country as the best childcare program that we would have had anywhere in Canada. We've been provided compensation and operating grants for this 3-month period when the centers have been empty and there's been no children there. The operators, the staff has been paid for. So this has been one of the best programs that have been in place, and we've been doing this for the last 3 months. So we have in Newfoundland and Labrador a combination of regulated and unregulated childcare programs. About 65% of them would be regulated. They get the operation grants. That will be continuing post June the 26th. And now you'll be at the capacity of moving up to the 70%. And keep in mind that it's not unusual, given this time of the year with school closures, that the population, the number of recipients in children in those child care centers, that changes. There's summer programs that were put in place. But the commitment that we want to make is work closely with this group, having child care spaces available as we open up our economy and people that go back to work, that having those child care spaces is available is very important. But, so right now we've had a real good program in place. I think everybody would have known that this is something that at some point will come to an end. These operators have been paid nearly 100% of their capacity over the last 3 months. So right now, there will be some changes that will come on June the 26th, and we'll get back into what has been almost a combination of pre-COVID time, making sure that they gradually open up the childcare spaces as the economy begins to open up.
And Premier, I'm wondering if there is any update on the Labrador-Quebec border following the meeting earlier this week.
Yeah, so what we've agreed to do is keep the RNC there, the Quebec Police Force. They've moved out of there as of May the 31st. So we've agreed now that given where we are with the travel conditions and restrictions that we have in place, it's important that we keep a presence at all our borders. And right now there will be the RNC will be back there on a 24-hour basis. There's some support there from public health as well. And this will be the case for all our points of entry into Newfoundland and Labrador, including Labrador South, the Port of Bass and Marine Atlantic, and including our airports. So it's important we keep a presence at all our points of entry.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Sounds like I want to ask another question about this second lawsuit regarding seasonal residents. It sounds like we're probably going to end up going to court for this one as well. That sets the province up to potentially to pay damages. Are you worried about that and the financial impact of these measures, given that we now have these two suits that have been filed?
Well, anytime you're looking at, costs to the provincial government, these are always concerns of ours. But primarily, the big concern for us is stopping the spread of COVID within our province. We must be very clear about this, is that we have seen outbreaks in provinces, typically that have been travel related. So it's important for us right now, as we're still living with COVID in our province. We know that this can easily come in. This can easily impact a large group of people. We've seen that just in recent days. So simply because we've done a really good job in Newfoundland and Labrador slowing and stopping the spread of COVID does not necessarily mean that you cannot have an outbreak into the future. So as we work our way through our alert level, it's important that we put those conditions in place. It's important that we remain patient. And as I said earlier, this is not a position that we'd like to see our province in, but these are measures that have been put in place to protect the general population of Newfoundland and Labrador.
I guess as a follow-up on that, part of the criticism coming from seasonal residents is that the conditions to which you're referring are in place in some cases, but not in others. So I guess, for someone who is in that situation, who's being denied entry, what do you say to them when they're comparing, say, a worker working at a camp in Fort McMurray who comes home and self-isolates, and a seasonal resident who says that they would do the same thing if they were to come to the province, put themselves automatically in 14 days of quarantine, and create an environment where they're not, to the best of their ability, propagating the virus?
I think one thing we need to consider is that these are secondary residents for some people, and it is difficult. I mean, these are people that I know and that we all know. We can all give examples of when we live in our province of people that we know that would come into in many communities in Newfoundland and Labrador that have bought property there. So all we're asking right now is for this particular summer, for this particular point in time, we'll see where this goes, into the future, where we will be. Anyone that's coming into or would like to visit Newfoundland and Labrador, there is a process through the exemption orders that you can actually write in. That would be analyzed, and the work would be done for those that would want to visit our province. So if the decision is there or the argument is made that this is the various reasons or the reasons that they would want to come into our province, that provision is there. That's what's happening in PEI right now. So if you own a property in PEI, my understanding is you would file for an exemption order. You would go in, and whether you'll be allowed to come and visit that property, that's the provisions that are put in place. So right now we're just asking for people that have those secondary residents and want to come to Newfoundland and Labrador. We thank you for wanting to come, but we're asking people to exercise a bit of patience during through this difficult time.
You mentioned earlier the $30 million envelope for residential construction that was announced today. The construction sector can continue operating during COVID-19, but there were $30 million announced for today. When you look at another sector that's been relatively decimated by COVID-19, the tourism sector, there's been just $25 million allocated as a sort of funding package for that sector. How do you explain that difference, given the differences between those two parts of the economy?
One of the things I think you need to consider are the complementary packages that are available, say, for the tourism industry. There was a number of federal supports that can support many of the operators in the tourism industry. What we're supporting with the renovation rebate that we've put in place today are many people now that are skilled workers. They work with small companies, they're renovation companies, could be large companies as well. And this is a way just to stimulate that part of the economy as well. So many of them have been displaced, and the tourism sector, as we said, and have we said already, the $25 million that we put in place there is complementary to many of the federal programs through either ACOA or many of the development associations that we would see within our province. On top of that, there are federal programs that were available as well. So that's a full suite of programs that are available there to help the tourism industry, as well as a staycation program that we'll be actually supporting as well. The renovation rebate is separate to that, and this is about property that people would want to spend and invest some of their money in, and on a $40,000 expenditure, they would get $10,000 back.
Our next questions are from Alex Bill of All Newfoundland Labrador. Please go ahead.
We're looking to find out where the status is of contact tracing in the province today. Is the province closer to developing or releasing a contact tracing app, and is that something you're doing on your own or in concert with other provinces in Ottawa?
So right now there's yeah, go ahead.
Sorry, Premier.
Yeah, I'll just be very quick, and you can fill in some blanks after. So, right now there's a national discussions that's happening around apps and technology to support contact tracing. From the work that's been done, this could be a very important component, but it would be one tool that's in that toolbox. At this point, it's very difficult to see any mechanism that would actually replace some of the great work that's been done with contact tracing. And we have some in our province. We can be very proud that we have some of the best that we would have seen in this country. And that was very clear as we dealt with the Calls Funeral Home event. So right now, as technology would support those contact tracing that's in place right now in all our regional health authorities, that has been the focus. If you speak to companies like Verifin, who's been doing a lot of work in this, where they see their best results would be through programming that would actually support contact tracing. And they can do some extraordinary work. They're globally known, and they've done some very good work into security in financial institutions. And it's very, very interesting to see the parallel as we bring this into tracing people who could potentially be impacted by COVID. So, John, I'm sure you have some comments to be able to expand on that a little bit.
Yes, thank you very much. I mean, I think if you look at conventional contact tracing and calls, we got over 90% of contacts identified within a reasonable period of time, to the most 3 days. And if you listen to Dr. Rahman's comments, the way to control an epidemic is to at least get 60 or 70% done within 48 hours. So Don Fitzgerald's team have really broke the back of that one. The advantages of contact tracing apps are up for grabs, simply because the penetration that you require is said to be 60 to 70%. And even in places like Singapore and Korea, where technology is much more pervasive than it is in Newfoundland and Labrador, they only managed at the best 40%. So the real value add from some of the work that's being done at the back end of contact tracing is around data analytics and using multiple sources of data to augment the contact tracing piece. And we have some of the world's best expertise here. There's not much difference, as Verifin said, between tracking an infection as tracking dodgy investments. So I think that's going to be a really exciting piece coming out soon.
Okay, so if I'm understanding you, it's more likely that we're going to see companies work with the province on data analytics for the contact tracing we currently have, rather than bringing in an app for individuals to use.
What we're looking for is we use the expertise that we have available to be most effective, and now we can support each other. As I said, having, and as the minister has said, having the app in place, we must be able to get to a significant mass of people that would have that ability on a smartphone, that they would travel with them, and it must be working, of course. But what we do know is, based on the experience that others would have had in other areas, and as the minister just mentioned about Verifin and their work with financial institutions, So we know that some of that knowledge can be transferred into contact tracing. And you're right, having that program available so that we can actually get there quickly. But also, what was interesting is to be able to prioritize who they actually call first. So all of these are important pieces, but they all complement each other in the contact tracing world.
I'm sorry, Mr. Haggie, were you following up on that as well?
No, the ground's been covered. Thank you.
Okay, so the last follow-up would be, you've both mentioned Verafin, and we've reported their involvement on this. Is the province and the health authority working with other companies on contact tracing currently? I understand Conduent in Manitoba has reached out. Can you provide the names of other firms that might be working with the province?
I wouldn't have the names of any companies that we're working on. All I know is that the federal government and other provinces are working very closely on what would be an app, what that would look like. And, Verafin is a group that has been well known in Newfoundland and Labrador and has had a lot of success in other spaces and can support what would need to be done here. They are also working, by the way, with the federal government as well. So all of this is really a lot of work that's being done. A lot of the work is being shared, one province to another province and with the national government as well. So this is really about bringing a process in place to how we use evidence, how we use the best applications, the best programs to support what is already a very good and sophisticated contact tracing network.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
I don't know if this is a question that Minister Haggie or Dr. Fitzgerald wants to take, but it sounds like as of Monday, staycations are going to be allowed now that you're no longer recommending only essential travel within the province. I'm wondering if you can give us an idea of, as people are trying to decide what they should be booking this summer, what are some of the best practices that you're encouraging in terms of the sort of vacations that people should be considering? For example, if someone says, oh, great, I want to go visit some relatives on the other side of the province, is that something they should be doing right now?
So I think you need to consider, a whole bunch of things, but all those basic public health measures that we talk about, those personal public health measures. So, maintain physical distancing. If you can't, put on a mask. Make sure that you don't go out if you're not feeling well. That you try to stay, or not, you do stay within your bubble. And that you keep those close contacts outside of your bubble as low as you can. And, you have to think about, that in terms of what types of activities you're going to be doing. So if you're going to be doing something where you know that you're going to end up likely in close quarters inside for a certain period of time, then you might want to think twice about something like that as opposed to being outside where you can be adequately spaced. I've said it before, we want you to think about people, space, time, place, right? So the fewer people as possible that you can come into contact with outside of your bubble, enough space so that you can physically distance, keep the amount of time that you're in contact with people outside of your bubble as low as you can, and then outside activities are safer than inside activities. So those are all things that you need to consider. But then the other thing you want to think about is, where are you going when you're visiting someone? So are you going to be visiting somebody who may have some health problems that you might need to consider protecting them? So maybe not everybody in the family goes. Maybe just one person goes if they really need some support and some help. And you need to think about the ways that you're doing that safely. Are you going to an area where there's a risk for introduction of disease into that area should you become sick? You need to think about all of those things when you're planning your vacations.
We've heard recommendations you were just talking about there about going outside, doing outside activities. We've seen the national parks this week now have a lot of their hiking trails, for example, are open. Why aren't provincial parks open for hiking as well?
So we're working on a plan now with the provincial park network. As you know, Peter, we have some great provincial parks, and as people move around the province as well, we're looking for ways now, working with the Department of Tourism, Culture, and Industry and Innovation, to put in those plans that will work in a very safe way that will provide people with a very good experience. And so right now, this work is being ongoing now within the particular department.
and my last question is for the Premier. I want to get you to elaborate on some of the comments you made in the introduction talking about working from home. After your comments during the Monday's briefing, I've heard from dozens of parents who've talked about the challenges and the struggles that they've had in trying to both work from home and look after children. Why are they being told by child care centers that even as of Monday, they can't put their child back in daycare as long as they're still able to work from home?
Well, right now with the child care centers open if we go back to this, there was about just over 1,000 people, I think, that would participated in the $200 a week for essential worker program. So there's two components of this. The essential worker program, we wanted to make sure that if you're a healthcare worker, an essential worker in Newfoundland and Labrador, very early on into this, that having available child care spaces was not something that was restricting you from going to work. We needed them. We wanted them to go to work. That program was a great program. As a matter of fact, not a lot of those people that took opportunity of that program, took advantage of that program, used the regulated childcare spaces. Very few actually did. Most of them found a room within their family network to be able to do that. That was in alert level, even before alert level 5. But as we started to open up our province, move from one alert level to another, in alert level 4, we went to 50% of childcare spaces being open, still continued on with the 200 a week for essential workers. Now we're moving into alert level 3. It goes to 70%. Schools are closed. And so right now that as people work from home, if you were pre-COVID, people would have left their home and went to work within, let's say, in Confederation Building. So it was about the location of where you provided and where you worked. So if you were working in Confederation Building, then you would have needed to be able to provide childcare spaces for those same children today. So right now it's about the location where you're working. Many people are working from home, and they can actually support the children as the best way they can as well. We know it's difficult, but yet if you think of pre-COVID, these same people were working and needed to provide childcare spaces because they were working out of that home setting. Now they're working home, and we've opened up the childcare spaces to some 70% of those people.
Thank you, Premier. We'll now take 3 quick questions. Operator, please identify the reporter when they press *1. Thank you.
The sourcing of PPE, are you aware of any recent developments in how that's being sourced?
From the point of view of PPE, Peter, we have a steady trickle from both our usual sources and through federal. We have, depending on the particular item you look at, anywhere from 1 to more than 30 weeks of some items. So we are matching what we use with what we get. The bottom line, though, is still that the bulk orders that we had placed back in January have still not been delivered. And we burn through, 3,000 items a day in some categories. So it is a concern as we try and do more in the way of planned and scheduled procedures that we don't run ourselves into a situation where we don't have sufficient. But at the moment, it's balancing. So as long as that's the case, then we can continue down this road. At some point, we are really keen to try and build up a stock against the next wave, and we're still waiting on Health Canada to do some certification work with our homegrown manufacturers, who would certainly be able to take some of the edge off that. Although I'm not even sure whether the capacity locally exists to meet all our demands, it would certainly make a big difference.
Thank you.
Our next question. Operator, do we have any further questions?
Yes, from Peter Cowan. Please go ahead.
Dr. Fitzgerald, I want to ask about one of the changes you made last week for workers who are flying back and forth. When they're under isolation, they can go for a walk. You've said there's a very low risk of transmission there. Why not allow anyone who's under isolation to go for a walk if the risk is very low?
So some of the people that are under isolation are there because of federal laws, and so we can't interfere with that. So that has to continue. I think right now what we wanted to do, we'd heard that, the hardship of not being able to get outside or not being able to leave their property and not being able to interact with people in their family was, in their immediate family, was difficult for some of those workers. So we wanted to ease some of those restrictions. We still feel that staying on your property is the safest thing and the lowest risk for people coming from outside of the province. So, but we felt that in this group, we were striking a balance between the individual health and mental health and public safety. So that's why we made that decision.
Thank you.
And our final question today is from
Patrick Butler for Radio Canada. Please go ahead. Mr. Butler, your line is open.
Sorry, I was on mute. Thanks. Premier, tomorrow we're supposed to have a financial or fiscal update. Can you give any details about what's on the horizon there? We know that there's been a lot of difficulties in terms of economically for the province. Can you give us any insight about what's to be announced?
Well, we know that we were prepared as part of the budget process. Quite a bit of this work was done, and we were literally about 2 to 3 weeks left in the finalization, into March the 31st. So, the numbers changed considerably. There's no question. It was a difficult year for the province, and without getting into the specific details, I'll let the Minister of Finance deliver that news to the province. But it's been a tough year for Newfoundland and Labrador, and coming out of this pandemic, there's been, without question, there's been a lot of pressure and a lot of stress put on the revenue generation. For Newfoundland and Labrador, we've been able to hold our expense line. We've done a good job in managing that, but it's the revenue that has been decreased dramatically. But the specifics and of the numbers, they will be released tomorrow by the Minister of Finance.
Thank you very much, Premier. The time for questions has ended. Please join us again on Friday, June 5th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.